How to deal with difficult aging parents. It can be difficult dealing with elderly parents that struggle with making the best decisions for their situation, especially if they refuse assistance or advice. But it is possible to communicate with your aging parents effectively. As a primary caregiver, it is possible to help them take charge of ensuring healthy choices are made, while still allowing autonomy and independence. Start by not falling into power struggles. Pick battles wisely when expressing opinions. You are still their child, and adult children are often dismissed and discounted by aging parents. Family caregivers must learn to be persistent but sensitive. Criticizing your elderly parents might put them on the defensive and encourage negative emotions, and not allow you to provide assistance for them in the future. How do you help your aging parents to accept care? As your parents age, it can be difficult to navigate the conversation about potential caregiving. Dealing with elderly parents can be a tricky situation, especially if they're prone to verbally or emotionally abusive behavior. Yelling, lying, accusing, and calling insulting names are just some of the common forms of abuse experienced by caregivers for their parents. There are also more subtle tactics like manipulation and gaslighting that make caregiving even harder on those involved. These are tactics that your aging parents may be using to feel in control at a time when their bodies and even their minds may fail them. Take some deep breaths and acknowledge that you may not ever change your family dynamics. Accepting this will allow setting boundaries to preserve your own mental health and even your physical health. Family caregivers find it difficult to set boundaries with an elderly parent or other family members. Is it normal to resent caring for elderly parents? Caring for an elderly parent who exhibits abusive behavior can be a difficult journey. However, by understanding the root cause of their anger and anxiety, finding ways to practice self-care, and utilizing techniques like deep breathing that help maintain calmness during tense moments, it is possible to establish positive relationships with parents while avoiding unhealthy ones from forming between yourself or other family members. Don't let anyone take away your resolve in taking care of both you and those around you. Navigating the challenging situation of helping aging parents who refuse help can feel overwhelming and confusing, especially with 77% of adult children reporting their elderly parent is stubborn when it comes to taking advice or getting assistance. Older adults hate change. It's important to take a step back and consider why they may be resisting support. Is it out of habit? Is there an underlying mental health issues, like anxiety or fear that needs addressing? Are they scared about losing independence? Or confused? This may be due to dementia-related symptoms. Compassionately address these feelings around maintaining independence, as well as facing reality in terms of age, then decide which battles you really want, need your elderly parents, or anyone accepting care on. Safety should always come first, but don't overwhelm them trying too hard at once. Last bit of wisdom. Accept what cannot be changed and understand everyone has a right to make decisions, even bad ones. Then prepare to manage by crisis, because that will happen. It is only a matter of time. Dealing with challenging behaviors? Are you dealing with an aging loved one that is angry, hostile, and has verbal outbursts? Dealing with aging parents can be incredibly challenging. As they age, their behavior may become more hostile or angry, which makes conversations difficult and often puts family members in a defensive position. I am sure you feel this is emotional abuse, and you would be correct in that assumption. It is important to try not take it personally and remember that the source of this aggression could stem from various factors associated with aging, such as feeling overwhelmed by life's changes or seeking control where there isn't any left to have. Some older adults may experience personality changes, have difficulty with performing daily tasks, and may be experiencing mild cognitive impairment. If you have not taken the Elder Care Communication course on caregiver relief, I suggest you look into that course. We help you learn how to listen and talk to your loved one. Communicating in a kind, compassionate way can make a big difference and help you to plan ahead for your parent future care needs. Keeping the lines of communication open. Let's get back to communicating with an aging parent you are providing caregiving for to help them age in place. Try explaining how their behavior makes you feel. Remember, you can also leave the situation as long as your loved one is safe before you go. The difficult issue that adult children face is the constant battle of the child-parent relationship. It is hard not to fall back into that child role. Many older adults, especially the women, have provided care to a loved one. Many that have been caregivers believe they are entitled to the same level of attention and care they provided to their aging parents. When the aging parent feels as if their family members should be giving up their life, their career, and taking care of them, anxiety and fear starts to creep into the aging parent's behavior. Unrealistic expectations of the elderly parents are the cause of many untoward behaviors. Accept that you cannot control everything. No matter how best your efforts, it's important to understand that you can't control everything. When it comes to dealing with stubborn, aging parents, persistence and patience are key. But don't expect to resolve everything in one go. It may take several conversations to get through. Also, try not to overwhelm your parent with too much information at once, especially if they have a cognitive impairment. Remember to avoid power struggles and respect their opinions. By empowering them to be part of the decision-making process, you'll build a stronger relationship, free of yelling and disputes. Here are some tips for talking to your parents about their well-being. Be sensitive, as criticism and judgment can make them defensive. Instead, use I statements like, "I'm feeling concerned," to express your thoughts. Timing is key. Don't pick a day when everyone's already stressed out. Choose a day when your parents are relaxed and open to discussion. Stay calm, even if your parents are resistant to acknowledging the challenges they face. Speak with love and tenderness to reassure them that everything will be okay. Taking care of stubborn aging parents can be a challenge, especially if you're feeling frightened, helpless, and frustrated. The emotional abuse is negatively impacting your health. Practice self-care every day. If that's the case, it's important to take care of yourself too. Join a meditation group, visit a counselor, or find a support group. Ask for help from a caregiver coach or a care manager. It is important to know, for every problem there is a solution. There is a solution that will be right for everyone. You just need to take time to find that solution. As you continue to support your parents, spend some extra time with them if the relationship isn't a source of conflict. Asking open-ended questions and proposing solutions will help your interactions become more harmonious. Together, you can address your parents' concerns and cultivate trust to support each other. Again, our Elder Care Communications course addresses many different topics and offers tips and strategies to use when you talk with your loved one. To make your solution irresistible, focus on the benefits. For example, with assisted living, your loved one won't just get the care they need. They'll enjoy a range of social and recreational activities. I recommend that family caregivers not to tackle caregiving all on your own. Keep your siblings in the loop. Call for a family meeting or encourage them to speak with your parents. Get everyone on the same page and striving for the same goal. In the Elder Care Communication course, I have a section on how to run a family meeting. I recommend taking a team approach to caregiving. Take a team approach to caregiving. Support your parents by enlisting the help of a friends or neighbors. Oftentimes, it's easier to accept hard truths from someone outside the family circle. Still not getting through? Reach out to your parents' doctor. In the end, they may be the one person your parents listen to the most. Sometimes it can be tricky convincing our aging loved ones to modify their behaviors, even when it's for their safety. It's important to approach them calmly and remind them that their decisions can affect more than just themselves. Try to be understanding and listen to their concerns, even if they're hesitant to open up. At the end of the day, if your parent is unwilling to change, it's important to respect their wishes and honor their independence. It's tough when our parents resist making key decisions about their living arrangements or driving habits. If you've tried gentle persuasion to no avail, it may be time to have a heart-to-heart. Here are a few things to keep in mind. It's helpful to remind them that their choices affect not just the family, but others as well. No need to talk down to them like they're kids. Just be gracious and honest about your concerns. A few gentle reminders that their independence shouldn't come at a cost to others may help. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.